Hello everyone. Today we'll be talking about the adult cardiac arrest algorithm. Okay, we'll be going through what are the frequently missed things during CPR. Okay, whenever we encounter a patient in cardiac arrest, okay, the first thing that are frequently missed is to start CPR itself. Okay, many a times when patient collapse, okay, we have to go immediately check the carotid pulse. Okay, if there is no pulse, you have to check the cardiac pulse for 10 seconds. Okay, if there is no pulse, immediately you have to start CPR. Many times people won't start CPR. Okay, they call someone or do many things. Okay, and if there is no carotid pulse, immediately go and start the CPR. Okay, and at the same time you have to call for help as well. Okay, many times people won't call for help as well. They will be single person cannot do CPR. You need at least 4 5 6 person to do CPR. Okay, you have to call for help. After that, if you have checked carotid pulse, there is no pulse, you started CPR, and then you have to attach the monitor. Okay, in our setting frequently we see people only doing chest compression. Okay, chest compression, there will be one person who will be starting CPR with chest compression. Okay, they won't even give oxygen as well. People, this is blunder. Okay, you have to give oxygen. Okay, bag and marks, you are immediately one person should start bag and marks, and you have to attach monitor. Okay, and after you have checked your cardiac pulse, there is no pulse, you have called for help. Okay, one person is there to give oxygen bag via bag and marks, another person will be there to attach the monitor. Okay, or defibrillator if it's available in your setting. Okay, after that you have to allocate a person. Okay, you have to allocate a leader. Okay, you have to allocate a leader who will lead to all the CPR algorithm. Then okay, there should always be a leader who should lead everything, who is not directly going and doing CPR or doing bag and marks. They that will look for each and every steps if they are completed or not. After that, whenever you have attached the monitor, you have started CPR, the leader will check the rhythm. Okay, whether that is shockable or non-shockable. Okay, after you see the rhythm, you have to notice whether that is pulseless VT or VF. They are very easy to recognize. If you see these two ECG, one ECG, this is of VT and this is of ventricular fibrillation. Okay, and if you are confused with this, there I have also kept the video on ECG. Okay, how to recognize different pattern in ECG. Okay, these are some of the frequently missed points during initiation. Okay, after we do CPR, we have started CPR. Many times people will not push hard. Okay, we have to push at least 5 centimeter, and that should be fast, 100 to 120 beats per minute. Okay, 100 to 120 times per minute you have to push, and you should not interrupt in between. Okay, you should not interrupt in between. After about 2 minutes of CPR, okay, after about 2 minutes of CPR, every time you can interrupt for less than 10 seconds. Okay, less than 10 seconds you can interrupt in between to check rhythm, or to give to change the person for doing chest compression. Remember, that is less than 10 second only. You cannot interrupt more than 10 second in between. That won't make your CPR effective. Okay, frequently people miss the dosing of epinephrine. Okay, dosing of epinephrine is 1 mg of 1 is to 1000 concentration. But remember, you have to dilute this 1 ml of 1000, 1 ml of 1000, 1 is to 1000 epinephrine with 9 ml of normal saline to make normal saline to make it 10 ml. Okay, you have to make 10 ml and push every time you give epinephrine, and it's given every 3 to 5 minutes, every 3 to 5 minutes. Okay, remember, this is the concentration you have to dilute so that it will reach to your heart. Okay, if you do not mix normal saline, it the volume will be so small it won't reach to your heart. Okay, this is also frequently missed after this one other major things that is missed, the reversible causes. Okay, if we are a new person to do CPR, if you are a new medical officer working in a developing countries, or a paramedics. Okay, because frequently I have seen the person doing CPR are not trained enough. Okay, if you are not trained enough, you will miss these reversible causes as well. There are 5H and 5T. Okay, hypovolemia. When to think a person is in hypovolemia? If a person, okay, was suffering from AGE, or frequently we encounter a person who has suffered from head injury or any other injury. Okay, frequently head injury person collapse and come with cardiac arrest. Okay, because of blood loss. Okay, hypovolemia is a common cause of arrest. Okay, if you encounter a person who has lost blood volume, you have to immediately think this is a cause of hypovolemia. You have to start crystalloids. Okay, you have to give IV normal saline to the patient immediately. Okay, hydrogen ion. Okay, acidosis. Frequently we encounter a person, CKD patient. Okay, a CKD patient, CKD patient. Okay, CKD patient under maintenance hemodialysis. This type of person, if they have missed their session, then might encounter severe acidosis leading to cardiac arrest. Okay, if I have encountered CKD patient, then you can give bicarbonate, but usually our practice is, whenever a person comes to with cardiac arrest. Okay, cardiac arrest, after attaching monitor or giving oxygen, here only in this stage only we'll do ABG. Okay, we'll do ABG to look for the oxygenation, to look for any like reversible causes. If you do ABG on initial period, you can know the status of acidosis. Okay, you can know pH of the patient. Okay, and we can know bicarbonate of the patient. Okay, we can know potassium. This thing also frequently lead to cardiac arrest. Okay, hyperkalemia, you can know the potassium from ABG itself. Okay, and this will help you guide and treat two of the important reversible causes. Okay, hydrogen ion, hyperkalemia. This thing leads to cardiac arrest. Okay, so ABG is also important if it's available in your setting. Okay, and hypothermia, patient with hypothermia is usually encountered in a trekking person. Okay, people go to trekking to the mountainous area, mountains. Okay, and they might be suffering from hypothermia. Okay, whenever they collapse, and that can also lead to cardiac arrest. Okay, and during initial assessment, if you listen to the heart, this long sound and hot sound, you can immediately know tension pneumothorax or cardiac tamponade as well. But during CPR, if possible, if you can do focus ultrasound. Okay, if you have focus ultrasound and you can do fast scan. Okay, like there is something called e fast scan. Okay, you can look for the cardiac tamponade. Okay, if there is any massive amount of fluid in around your heart, you have to immediately decompress that. If tension pneumothorax, if you think the person is suffering with tension pneumothorax, you can always decompress that with a needle thoracostomy, which is usually done these days in the of safety. And pulmonary thrombosis and coronary thrombosis, little bit hard initially, but whenever if you get ROSC. Okay, ROSC, after that you can always go for troponin, and look for any ST elevation or like that in your ECG and find out these two things. Okay, so this much for the CPR portion. Okay, and after CPR as well, there is frequently missed portion. Okay, after CPR. Okay, after CPR, what are the things you need to do? Okay, if you got, there is ROSC. Okay, there is spontaneous circulation, return of spontaneous circulation. After that also you have to maintain BP of the patient. Sometimes you need epinephrine. Okay, epinephrine via infusion. Okay, and maintaining temperature, okay, targeted temperature maintenance again is a very important things you have to do. Okay, maintaining targeted temperature are frequently difficult in developing countries where there are no much sophisticated ICU or even other instrument as well. That's why this might be a challenging thing to a developing country. But maintaining BP, maintaining oxygen saturation, okay, after intubation sometimes you need to manipulate your intratracheal tube and put the appropriate size of intratracheal tube. This thing and finding the cause are also important after CPR, after return of spontaneous circulation as well. This much for today. Hope you liked the video. If you like similar type of concept, you can always visit my YouTube. There are many such other video as well. Thank you. This much for today.